It's Saturday, and the cold you've been nursing for the past few days seems to be getting worse. You have vomited once and have a fever. Should you head to a hospital emergency room or an urgent care clinic? If you've ever wondered whether to go to an ER or an urgent care clinic, you're not alone. As emergency medicine physicians, we are often asked by family, friends, and patients if their symptoms warrant an ER visit, a trip to an urgent care clinic, a call to their primary care doctor, or simply management at home. It is important to listen to your body and assess the severity of your symptoms to prevent filling hospital emergency rooms with mild illnesses or injuries that could be managed elsewhere. You could also avoid a long wait in an ER when an ER may not be the level of care you need.
If you are experiencing mild symptoms, such as a temperature below 100 degrees, aches and pains, a mild cough, that could be caused by the flu, COVID-19, or hundreds of other viruses, I would start by doing what your mom used to tell you: rest. Drink plenty of fluids, take over-the-counter medications like Tylenol, if needed, and monitor your symptoms. If your symptoms are not getting any better over time, or worsen, and you feel you need to be seen by a doctor, calling your primary care physician first is beneficial. Many primary care physicians are now offering virtual visits and can assess patients by phone or video calls fairly quickly. Always remember, if the urgent care provider thinks you need a higher level of care, they will get you to the ER.
For more immediate or after-hours care, a trip to an urgent care clinic can be a great solution. Unless it's a true emergency, urgent care is generally a better use of a patient's time and resources. Many of them are open 7 days a week, have far shorter wait times than the ER, and cost less than a traditional hospital emergency room visit. Many urgent care clinics also have advanced diagnostic imaging, like X-ray machines, and lab capabilities to assess your illness or injury on-site. Urgent care providers can prescribe medications and recommend a higher level of care if needed.
Call 911 or come right to the ER if you're systemically sick. That is when an illness affects your entire body. You have severe pain or sudden onset of severe symptoms, a fever that won't break, or something doesn't work. When you are unable to move an arm or leg or breathe normally. This includes a person with a severe injury or allergic reaction if they pass out or experience any signs of a possible stroke or signs of a heart attack. The cost of an urgent care visit is much lower, especially when you use your money map. Additional benefits to you when using an urgent care facility include shorter wait times, location convenience, and less crowded wait areas. Less crowding means less chance of infection with a communicable disease, a mission-critical factor in the age of COVID-19 and COVID-19 variants.
Use the emergency room for shortness of breath, chest pain, left arm pain, or left jaw pain, serious burns, cuts that won't stop bleeding, or wounds that won't close, seizures, severe allergic reaction, swelling of lips, difficulty swallowing or breathing, stroke symptoms including slurred speech, sudden numbness, sudden weakness in any area of your body, facial droop, loss of balance or vision, a change in mental status such as confusion, loss of consciousness, multiple injuries or possible broken ribs, skull, face, or pelvis. If you are pregnant and have vaginal bleeding, pelvic or abdominal pain.
Use urgent care for fevers and colds, vomiting and nausea, diarrhea, dehydration, strains, sprains, or simple bone breaks, or, in the case of suspected broken ankles or knees, if you can still walk on the injured leg with some discomfort. Minor cuts, mild asthma attacks, pain with urination.
It is important you know if the urgent care provider thinks you need a higher level of care, they will get you to the ER. For your routine health care, your primary care physician is the best source of care. If your primary care physician is not available for most illnesses and minor injuries, an urgent care facility on your money map is your most appropriate option. When in doubt about the seriousness of a condition, default to the emergency room. We never want to sacrifice quality of care for your convenience or savings.
And never forget, an apple a day keeps the doctor away.